Thank you so much, Andrew. Wonderful presentation, very interesting as always. We appreciate having you. I'm going to move quickly to our final session today. We have our very own CHIME Vice President of Public Policy, Mari Savickis, and she's going to give us an update on cybersecurity policy. Thanks, Mari.
Hi, Lisa. Thank you. And I promise to have you out of here on time. So there's some good news coming out of Washington. So don't leave. I'll get to it super fast. Want to thank Andrew for the Netflix recommendations. Totally add that to the list. I'm going to have Carol put in the chat my calendar. We really want to invite you to schedule time with me and my team. We have lots of cyber whispers here, and some of them are on this call. And you are incredibly helpful to us. We take everything that you say and we translate it into a story and a narrative when we go up to Washington. And we'll be there tomorrow, meeting with policymakers and lawmakers on privacy and security. So I guess while I'm speaking, I would just ask you, if you were in front of a key policymaker, what would be your top recommendation? So I want to see that in the chat. If people can put that in for me, it actually helps me tremendously. So as we're doing that, I'm going to move us to slide 2 and just briefly cover that we published a set of AI principles, and I'll just leave you with this. There's significant amount of discussion within the AI principles. So slide 2, which is around privacy and security. And I don't see my slides up, so maybe Carol, they need to go up. So it's 61 pages. It's a long document, but we spent a ton of time focusing on cyber and privacy. So that's just something to note. And we have links in here, and I think Carol's going to send out the deck after this, but it's just worth, if you want to know what we have to say about cyber and privacy, it's all contained in our AI principles. And we broke it into 3 pieces, but I'm going to get through everything fast. So I'm going to have to gloss over a few things in our slides. Slide number 3 is just basically what do we advocate for here in Washington? We are asking to rescind the HIPAA proposed security rule. We're asking to reauthorize CISA 2015. I've got some good news on that, so stick around. And we're advocating for a national privacy law and greater protections for health data that lives outside HIPAA. So much easier said than done, very hard. Slide number 4. This is the backdrop. I'll just leave you with, like, there's a lot of cyber threats. Everything you've already heard today is a backdrop, essentially. CIS is expiring. That's important. We're going to touch on that in a moment. We've got the midterms coming up. There's everything that you read in the news. So I'll make it quick here. Slide number 5. So this is where I want to spend a little bit of time. Federal funding ends for the federal government on January 30th. We all got a taste of what it looks like to have the government shut down. Not great at all. However, better news is there's less of an appetite to shut down the government in 10 days. So we're trending in the right direction. Early this morning, lawmakers came to an agreement around, like, the last few bills that need to be passed for appropriations. They're the tougher ones, like HHS and Homeland Security, though I think they're ironing out some details still with DHS. Now, the good news, so I got to give you some good news today because we live for good news. It looks like they're going to reauthorize CISA 2015, which is the threat sharing protections that were established 10 years ago. So that's the good news. The not so great news is it would just be extended through the end of this fiscal year. So that ends again September 30th. However, that's where it's looking like. Both chambers have to pass this and sign it, and the president has to sign it into law, but we're moving in the right direction. And again, for those of you who track the state and local grants that were, I think it was like $1 billion, that's also included. Those were established several years ago. So that is looking all included. Hopefully, fingers and toes crossed, we're moving in the right direction. This is a side note for anyone who cares about telehealth, that's also included. And so that will also be hopefully moving across the finish line. Again, believe that's 2 years, and hospital at home is 3 years. So I'm talking fast, but I know I got to get you in and out. So you can message me if you have any questions, and I'm happy to talk to anyone. So let's move on to the next slide. Oh, one more thing about this slide is that it's going to be a thin margin in the House. So again, we're going to white knuckle it through on this one, but we're going to hopefully see the bills pass. And there isn't as huge of an appetite for shutdown this time. So that's the good news too. Okay, I'm going to come back to slide 6. All right, let's skip slide 6 for a moment. And we're going to just stay with the congressional stuff. So some of these slides are already dated because I created them on Friday and the lawmakers worked over the weekend. So I'm sorry, some of it is outdated, but there's been a lot of work by Representative Garbarino to extend the CISA, and I think he's going to continue to fight for a 10-year extension. But for now, I think you're just going to see that short-term extension go through September 30th, which you can still share threat information. This gives you the power of law that protects it, which is so much nicer, right, than doing it on a wing and a prayer. So there were some competing proposals. I'm going to skip over this because right now it seems like this is moving forward, but if you want to see the competing proposals, you can see them on slide 8. I put a little table together for you. It's Senator Rand Paul. He's very powerful. He's the chairman of the Senate Homeland Committee, and so he had a different outline for this reauthorization that had nothing to do with cyber. It had to do with some removing some issues around free speech and things that are not related to cyber. So that was sort of the holdup there. But right now it seems to be moving at least temporarily through the end of the year. So these are the bills that were in play, and I think you'll still see a fight to extend this over the long term. Slide number 9. I've covered a few bills that people actually might care about. So this one is the healthcare, cybersecurity, and resiliency, and I know we're one slide behind, Resiliency Act. So this bill is Senate 3315, and it's led by Senator Cassidy and some other senators. It's bipartisan, and we like this bill. It has grants for providers, which this is something that CHIME actually has fought for years. Thank you, Cassie, and my team who's been working super hard on that. It includes some training and best practices for rural health entities. It's enhanced coordination between HHS and CISA. It was born out of a huge bipartisan healthcare cybersecurity working group in 2023. We've been very involved in the conversations to move this forward. So a ton of time and effort goes in, which is why I need you guys to be my cyber whisperers. So please reach out to us if you want to contribute to the conversation. Let me move to slide 10. This is another, they all sound the same. I'm not going to lie. Here's another one. Healthcare Cybersecurity Act of 2025. This one's sponsored by Senators Rosen and Young. This is basically a bill about coordination. Who can't get behind coordination? So that's out there. Slide 11. This one's worth noting, okay? Health Information Privacy Reform Act. This is what I'm calling like a national privacy law for healthcare. That's worth pausing on. So it's led by Senator Cassidy. He's the chairman of the powerful Senate Health Committee. It would place new requirements on non-HIPAA covered entities. So when health data is held by a non-HIPAA covered entity, under this bill, they would have to protect it in a HIPAA-like manner. This is a big deal. However, it is not without opposition. And so we're going to be watching this closely. We're weighing in on it. We're giving feedback, but it's definitely something to pay attention to. Moving on to slide 12, but I got 5 minutes. Making it fast here. I will skip this. I mean, I think it's just worth noting that the Senate and other lawmakers are paying attention to AI cyber attacks. They absolutely are. AI-driven cyber attacks are on their mind, and so that's good news. Okay, this one, slide 13. I'm going to switch over to the agency side or the federal side of the house. This is definitely something, if this is not on your radar, it absolutely 100% has to be. The Make Health Tech Great Again timeline and what is going on here. I touched on this last year in October when I presented. And slide 6, we don't have to go back to it. It has a lot of details. But again, just to go back in the time machine, President Trump, along with Administrator Oz and Secretary Kennedy, rolled out an entire plan with Amy Gleason, who is the head of DOGE, remember DOGE? And the play here is to use APIs, okay? It's an API playbook. They have essentially focused on a voluntary effort to get stakeholders across the ecosystem to join into their voluntary interoperability pledge, and they're going to use digital identity, and they're going to facilitate the use of health data moving from a provider setting out to third-party apps. So this includes using the tools that they have in their arsenal, which is the ASTP rulemaking around certification for EHRs. They're ripping up the playbook there, and they're going to focus on APIs. So that's definitely worth noting. And so these are things that we're paying attention to, and it's definitely worth taking a little bit of a look here. I don't have enough time to get into this deeply, but I do think it's worth understanding what CMS is doing. If you haven't paid attention to this and are not on your radar, you absolutely need to take a look at this. Let me move to slide 14. This is just a screenshot of ASTP, otherwise known as ONC. This is what they're going to do with the privacy and certification criteria. So those of you who stuck around to the bitter end, this one is also worth taking a look at. And Chelsea from our team has put together an excellent summary of the HTI-5 rule, hundreds of pages, so you don't have to read it. They are taking away the privacy and security criteria for certified EHRs. So that's something that's noteworthy. We will be commenting. Slide 15. By now, if you haven't heard about the Rural Health Transformation Fund, $50 billion, a lot of money, even in DC. This is rolling out right now. The grants were awarded right before the start of the new year. We were told today that New Jersey's already closed their application process. So the money went from CMS to the states. From the states, it will go to subrecipients. So you can see, like, I quickly looked at the New Jersey. It has cyber in it. It has IT stuff. It has hospitals can be subrecipients. So definitely, if you're focused on state activity and you want to get involved in this, you should be paying attention to what's coming out of your state. So and for those of you who are members of CHIME, we have an excellent resource that I can share with you. So please message me on this. It's very detailed. It's put together by our partners at Thorn Run. Slide 16, it looks like I got 2 minutes to spare. Assisted leadership. It's in transition. The acting director is actually going to have to testify before Congress tomorrow. And, you know, sometimes it feels like DC is like made for TV. There's a lot of drama around this. So he's going to be testifying tomorrow. And the Sean Planky nomination, that's Trump's nomination. He is still kind of out there rattling around on hold for reasons, again, that have nothing to do with cybersecurity, but is still on hold. And then there's also the rulemaking on CERCIA. That is targeted, I'm air quoting targeted for spring, but that's aspirational. And of course, by now, I think you all know that the staffing at CISA has been fairly dramatically caught. Slide 17, almost at the end here, folks. Privacy. Remember about the APIs and the CMS play and all that stuff about make health IT great again? Pay attention to this rule. HIPAA proposed security. I'm sorry. Did I say? Oh, this is the HIPAA security rule. We already covered this. Let's go to the last one. HIPAA privacy rule. This one is coming. This one you need to pay attention to. It will, in all likelihood, have APIs. Okay. This was published many years ago. During, I think it was like the very end of one of the administrations, the Trump administration, and it was published right after he left office. So it has like President Trump's fingerprints on it. I think it was published like the day after when Biden took office, but it's coming back. So it's worth noting this because it's going to focus on APIs. I am at CHIME. You will find me and my team here. And again, you have my calendar, and we definitely need more cyber experts. So please don't be strangers. I don't know. I probably talk fast, Lisa. I hope I'm not fired. Am I fired?
No, great job, Mari. We really appreciate it. Can you keep that last slide up, Carol? There's contact information for Mari's team. I hope that you all will reach out to her. And I want to thank everyone for joining us today on our January summit focused on strategy. And we look forward to seeing you in the fall when we focus on tactical solutions. So thank you for everyone who participated today and everyone in our audience. Have a great evening.